Hi everyone, Laura Hooper here. Let's talk about developing evidence-based periodontal protocols. And so we're going to talk about aligning treatment with our pathogen levels, the role of our products in treatment, and incorporating specifically our cell life products into these protocols. So first, let's talk about aligning treatment with pathogen levels. This is where saliva testing really shines because it allows us to make the best treatment decision. In fact, it can drastically change your decisions based on what's there. And so I'm going to globally just kind of go through this. And I want you today to be thinking in two main categories. Do I have red complex or do I have orange complex? So let's look. If you do have just orange complex, right? This is easy. This is what we were taught to treat in school. In fact, the orange complex responds to treatment. It responds to products. And our two core species are even in these categories, our FN and EC. Those are supposed to be there. They're seen in health. And so it's important to be looking for those. So this one, super easy to plug in then our products and go from there. Now, our red complex, this is the trickier one. And here's the biggest things to remember. Pick up your pen, get your paper ready, because write these three things down. The red complex is so unique. It controls all the other species. In fact, it exchanges its DNA. And so it can make a biome that's normally benign now act very pathogenic. That's huge. Change the entire microbiome. Secondly, the red complex, yeah, those are the 0.1%. The PG, the TF, the TD, these guys are resistant to many treatment and products. So we need to know if they're there. And then third, this is mainly why oral is systemic. These guys specifically can cross any lining in the body. So it's important that we know if these red complex bacteria are there or not. And we have studies to show us why they're so resistant. In fact, we can see that they're resistant to scaling and root planing. But if we combine that and not just do monotherapy of scaling and root planing, but we combine it with our antibiotics treating that bloodstream, we see that we get higher reductions in these microbial areas of the red complex, and not short term. We can even see much longer term out for months at a time. So it's important that we understand the use of combination therapy, that yes, we still have to be really good at breaking up the biofilm so that the antibiotics can work, but we want to make sure we're using the right antibiotics in that combination treatment. In fact, that's what this antibiotic study from 2023 is so important, because it demonstrates the red complex being very resistant to many antibiotics. In fact, here in the United States, the red complex is most resistant to clindamycin. The second thing it's most resistant to is amoxicillin. The third most resistant is doxycycline. So what does work on the red complex? Yeah, you got it. You're looking at it. Metronidazole and amoxicillin. Again, combination therapy actually has zero resistancy here in the United States. So I want you to be very confident when we need to treat the systemic system that we're actually choosing the right combination and the right antibiotics, and that we're not contributing to antimicrobial resistancy. In fact, we need to know a couple rules about antibiotics, because you heard me say combination therapy. Yeah, those antibiotics, look to your left-hand side here. Yeah, they have to be delivered within 4 hours. Otherwise, that extracellular matrix reforms and it actually creates antibiotic resistancy. Even if you use the right antibiotic, it cannot penetrate through that to get to that biofilm. So we have to break up the biofilm. We want to make these platonic. No, they're not coming back up on top of your tooth to be cleaned off. In fact, many of them are creating a bacteremia. They're going into the bloodstream. Yes, we're talking about these very specific red complex. And so that's why it's very important that the patient understands to take those antibiotics and to take them very strictly. But we want to make sure we break up the biofilm, right? So we got the antibiotics. We know we need them. We know we need combination therapy. How do we break up these biofilms and get to that extracellular matrix so that we can penetrate through? Yes, I'm talking about the red complex here because remember, orange, almost any treatment products work. We're specifically talking about this red complex. And what I love is that lasers are pigmented bacteria are attracted to it. So if you have a laser, please write this down. It's one of our number one treatments. Again, it can only permeate so far into the tissue. So we can't laser through the bloodstream, but we want to get to the source and we want to shut it down as much as we can. So great treatment here. The next one is our airflow therapy. And there's lots of companies out there, again, just like with lasers with airflow, but we know it definitively breaks up that biofilm for us, especially immediately. Now it's going to reform. We have those couple hours, but again, a great way to both remove that enamel pellicle and that extracellular matrix. And then if we don't have those things, don't fear because 15 years ago, I didn't have those either. I've been a hygienist for 30 years. We can do good old cavitroning and piezo tips, but we do have to make sure that we're getting to the extracellular matrix. So we want to make sure that we're using repetitive therapy, multiple tips, many times on higher power, because we do have to break that up. So consider that, be looking at your tips. You can still do that. And now in 2025, we have some really cool things coming out. We have that endoscope that's being really refined where we can actually see now subgingivally and be looking right at that root surface. And so there's many companies out there, but able to give us that visual where we're able to see and make sure we're not burning calculus, we're removing that biofilm, we're actually getting to it and breaking up the extracellular matrix. So with that, we have to remember these red complex, we just said, are resistant. So to treatment and products, we want to make sure we break them up. We've known for years, all the way back in 2002, that, right, even if we break up those biofilms, right, and we're doing scaling and root planing, that they can start to return to their pre-treatment levels in as little as 3 to 7 days. And our Journal of Medical Microbiology of 2021 told us, yes, they confirm this because we cannot completely eliminate them. We can reduce them with mechanical and what we call oral treatment, but once they're in the bloodstream, we cannot stop them from entering the bloodstream. We cannot stop the patient from swallowing them, and then once they're there, we cannot stop them from crossing the linings of the body. So we do have to understand the unique properties of the red complex, why oral is systemic, and why we need this type of combination therapy specifically for this red complex. In fact, that goes on to even to products. So we just talked about treatments. Well, what about products? Same thing. The red complex are resistant to many products. And we have a lot of studies. Again, when we go to the science, we need to be very knowledgeable in these areas. So we're choosing the right products. In fact, look on your left-hand side here, as you can see, PG works with FN. We can talk about that gene transfer, and it allows it to survive in oxygenation up to 10 to 20%. We've known PG and TF work in these areas, kind of manipulating their environment. And when you look on the right, they actually form these proteins. They're called oxy-R homolog proteins, and they form these structures that help them not only survive in these types of chemicals, but actually thrive and grow. Yes, your patient can get worse. You can actually be increasing because as you wipe out the healthy species that are susceptible to these types of products, but you're increasing and allowing the very virulent pathogens like the red complex to grow. And we know that. We've seen this with oxygen and peroxides and many other products. In fact, study after study shows us here that it's this chronic daily exposure to these type of sub-effective concentrations of these antimicrobials that we're using. And so we have to be very cautious when we have the red complex. In fact, They have shown us the most resistant ingredients. And so here's just a top list of those. Yes, you can take a look at that. They're in many of our over the counter and many of our dental products that we carry. So again, it's specific to the type of pathogen and it's specific to these red complex. In fact, in 2016, our FDA actually came out with an initiative to raise awareness amongst us, the dental community, about the risk of resistance towards antiseptics in general. And yes, this article specifically was naming the ingredients of our CPCs and our chlorides. So we have to be knowledgeable in this area, again, not only to get the best treatment decisions, but the best product decisions for our patients. So I always say why testing is so important because I can't see those red complex. It's impossible. We actually need a microbial test to tell us if they're there or not. And so testing shows us what we cannot see so we can make the best treatment decision and product decision for our patient. So let's look at products that actually do create health and don't create resistancy or increase that red complex. In fact, one of my favorite products are probiotics because they create health, but they also repair the epithelium lining that we need good integrity. And so probiotics, Stella Life, makes an oral probiotic that has 11 strains. It fights bacteria with bacteria. It affects and attacks our yeast, our candida. It's going to attack our strep mutans, our caries, and it's going to help create that healing. They have both an oral and a GI that have pre, pro, and postbiotics. So we're covered on all three fronts. Again, great product to choose when we need this type of activity. And so what these types of probiotics really target are our orange complex as well as some of our red. And it's so important that we're attacking it bidirectionally because remember, patients are swallowing this and their GI is infected as well. So we want to repopulate and create health in both areas. And so a great solution for that. The second thing is many of our patients aren't fighting off these infections. In fact, they don't have what we call the precursors or the nutritional support to do that. Their host may be taxed, maybe they have yeast, maybe they have a virus. And so they cannot actually help themselves heal or defend themselves against these bacterial fronts. And so they have at Stella Life Dental Medica, which is amazing for this supportive that we need in our combination therapy. So again, we can plug and play these into our periodontal therapy patients, our implants, our surgeries. And so the main thing is that we actually want to grow bone. We want healthy structures, right? We need these types of nutrients for healing to get cell growth, tissue repair, and really general immune health. In fact, Stella Life was part of a study that showed that when they tested patients, that our average population, 70% of us are deficient in D3 alone. We need K2 and D3 to build bone, to heal, to fight off infection. In fact, if you're D3 deficient, you now have a 300% increase in your implant failing. Yeah, take that away. What is also great is that they do offer a D3 test. So if you're wondering, oh my gosh, could I actually test and find out? Are my patients, if I had 10 patients, I already know 7 out of 10, right? Do we need to give them that support? And I will say that most patients don't just need the D3, they need the other things that are in there for that immune support as well and bone health. So what's really unique about Dental Medica is that in the market, it is such a clean product. I just want to highlight a few things here. Look at this D3. It is vegan. So importantly that it's a good source. Well, how about its K2? Yeah, it's MK7. And look at this. It's from the cleanest source that you can get your vitamin K2 from. It also has your B vitamins, both B9 and B12 that are methylated. Remember, a lot of your patients aren't methylators. If you've ever heard of MTHFR or you're working with a physician who tests for that, right? That means means that this patient can't actually break down that B vitamin. It's almost toxic. Well, they've given that highest level. So these are methylated for the patient and very safe, and the patient can utilize them. The other thing is the calcium they chose is the calcium citrate, as well as not having magnesium stearate in it. So it's not only what's in it, what's not in it. And so it's really important that we're educated on that we're giving the healthiest version for our patients, ones that they can absorb, ones that they can uptake. And this covers all our bases. So very important when you're looking for that nutritional support. Well, how about the recovery kit? This, hands down, is probably one of our most used products because we can establish the healing right away. We put it in our periodontal therapy, our implants, our surgeries. It just improves healing. It speeds up recovery. I'm going to say that again, speeds up recovery, and most importantly, reducing pain. So if you have somebody who has a lot of bleeding, a lot of pocketing, right? We can see a lot of inflammation. We know there's a lot of pain involved there, or discomfort. We want to relieve them of that and get them recovering as fast as possible. I also am a big fan for their rinse, not only to use in these protocols, but not every periodontal therapy patient needs sometimes that higher level. Sometimes they just need to improve the healing and get in microbial balance. And so this rinse is such a great piece to be able to add in your daily protocols. So this could be just with your maintenance patients, it could be with your gingivitis patients, and of course, that periodontal therapy patient where you're like, they don't have that much bleeding. So, right, do we need to go to the recovery kit? Hey, we can at least give them the rinse and get these things going, and it makes it super simple for the patient. I do want to show you one of my favorite studies, though, from Stella Life. This really got my attention because I'm so into the airway to pathogens to plaque that so many products out there wipe away our healthy bacteria, our healthy commensals that actually are in the process of making nitric oxide. So not only do we have patients who don't make nitric oxide through nasal breathing, but then they're out there taking away the healthy species that break down nitrate into nitrite into nitric oxide. So what did Stella Life do? Well, it put its own products to the test. And we can see here that this coconut rinse went up against this hydrogen peroxide and chlorhexidine, and it came out the winner. In fact, it did no effect on the nitric oxide levels, letting us know that it's protecting those commensal healthy bacteria, and it's not creating those types of resistancy, which is so important specifically for these types of bacteria. So you might be like, whoa, Laura, I'm overwhelmed. How am I going to remember this stuff? Well, here it is. This is my brain on paper. I like to get a test back and just say right out of the gate, do I have that red or orange complex? Yes or no? No, if I don't, I only have EC and FN. Those are core healthy species. Then I'm going to keep doing what I'm doing and just yearly test that patient. But if I say yes, I do have the orange or the red and purple complex, I'm going to break them up and separate them into two categories. I'm going to put in the red box those high risk, the AA, PG, TD, TF, and even our Pseudomonas. And then I'm going to put these lower risks, the PI, the CR, FN, FA, and EC, those orange complex, into that separate box. And so I really define that. If we have the red complex, we know that they are systemic. And so we need that combination therapy with antibiotics. And then we need to rebuild and repopulate so these infections don't come back. And that's where our oral and GI probiotics come in, and then our home care products. Versus with our orange complex, hey, we don't need antibiotic intervention many times. We just need really good treatment. And again, get the good healthy in. We need those oral and GI probiotics to repopulate and then get them on those good home care products. So take this away. I'm going to show you here just really quickly what that looks like with the orange complex. This is my proven protocol that when you do your saliva test, you see that you just have that orange complex. You're going to go in there, disrupt the biofilm with whatever you have, right? You're going to break that up. You don't need that antibiotic because orange responds to treatment and products. So we're going to get them on that home care kit, minimally that rinse, right? We'll get them on the coconut rinse. We're going to get them on the oral and GI probiotics. And then we're going to post-test them before that perio maintenance. So it's typically around 3 months, 90 days. And we want to show the patient the progress that they're making. Now, This is what it would look like on the test. We can see those orange complex. We're going to go after the biofilm, just what we talked about. We'll get that treatment. It is oral treatment and those products. So very simple protocol that you can start tomorrow. Well, how about when it's red complex? Here's our red complex proven protocol. Again, we're going to test. We need to know if the red complex are there. We're going to do those treatments, whatever you have to break up that biofilm, really make sure that we're taking the time to do that. But now we know with the red complex, these are the ones that can cross the lining in the body. This is combination therapy. We have to treat it orally, but also systemically. So that's where our antibiotics are going to come in. You can either do amoxicillin 500 milligrams TID, that's 3 times a day, or you can bump that up to amoxicillin 875 milligrams BID twice a day, and they're both with metronidazole. So we're always combining. Remember that study from 2023, that 20-year study showed us that we want to use the combination. So in red complex, think combination. I have to do combination treatment. I have to do combination antibiotics, amoxicillin, metronidazole, and I'm doing combination even in my home care. I want to use that recovery kit, the rinse, the spray, the gel, and then my oral and GI probiotics. Now, for me, I like to test at 15 days. I want to make sure I broke up that biofilm and the patient took their antibiotics. And then I do post again at their next maintenance, which typically is 90 days or around 3 months. And so that's really up to you. Again, I'm just showing you one really successful way, but look at these. Again, it's very easy to plug and play into your protocols. And so again, you get the test, you see the red complex are there, you're going to run your red complex protocol. You're going to break up your biofilm. You're going to treat both the mouth and the bloodstream. It's systemic. We're going to use those antibiotics, amoxicillin and metronidazole in combination. We're going to get them on the right products, especially our oral and GI. And now we need a lot of healing. We have a lot of inflammation, right? We have a more aggressive infection. We're going to use that recovery kit. And then again, your home care kit of paste, floss, brush, whatever you need. Very simple protocol that is super successful. So take a look at that. I just want to highlight that what would we do different with an implant case? And so many times on our implants, a very high rate, probably over 70% of the time, you also have a red complex. That's usually why you're losing bone, right? Why you have peri-implantitis. You're losing bone around that implant. So you're still going to make it easy. We're going to run the red complex, right? We're going to break up the biofilm, whatever we have. The treatment is still oral and systemic, but here's the catch. If we have that peri-implantitis risk, that pseudomonas, we pull out the amoxicillin and we plug in the ciprofloxacin. It's still in combination. Yep, it's still with metronidazole, but we just take out amoxicillin and we have to attack the pseudomonas and we put in the ciprofloxacin with that metronidazole. Again, we're going to get them on the oral and GI probiotics. Here, I'm really going to step it up because I know this patient needs support. Get them on our nutritional supplement, the Dental Medica. We've got to support that bone. We got to support the tissue healing. And again, that's going to be in combination with our recovery kit. So again, super easy. We're just looking for the peri-implantitis. This is an implant case. We know it's oral systemic. We're just seeing if that's there. We're going to pull out amoxicillin. We're going to put in the Cipro, and we're going to add support to the systemic system through Dental Medica. Again, nice, easy protocol you can run tomorrow. But I thank you for joining me. I'm always honored to share my top 6 protocols to be able to give your patients the health they deserve. Again, always check out the resources available through Stella Life. You can always directly contact me as well. But you have so many valuable education and resources here. Please reach out, please use them, and you can always ask your local representatives to help you with these protocols, plugging the products in where they need to be. I look forward to your future success.